This is part 2 of the diagnosis and then my experience with that. And if you have suffered from pregnancy loss, this might cause you to feel some way. If you're a really empathetic person, you might feel some way. I had my first ultrasound appointment in August, and my husband thankfully was able to get off work, and we checked in, and then they sent us back to our ultrasound. And this OB's office has the ultrasound screen visible to patients, which I imagine for most people is so they can see everything going on. And they had a bathroom for me to go into to change, but she didn't have me change initially. She was just going to do an abdominal ultrasound. But as soon as she was scanning, she told me I had a tilted uterus, which makes it difficult to see on an anterior abdominal ultrasound. So they had to do a transvaginal ultrasound, which a transvaginal ultrasound, they have a specific probe. It's a long, skinny stick. And they put like a condom looking thing on the outside and lube it and insert it through your vagina to view the uterus. So they put the ultrasound probe in, the ultrasound technician, and she was looking around, and then I could see, and she labeled something as the sac. As she was measuring, she measured the sac, but there was nothing inside the sac. And I could see that. I could see that there was no embryo, because at that point I know what it's supposed to look like. And it wasn't there. But the ultrasound tech said to me, I'm seeing a sac, but not really anything else. And then told me I could get dressed and that I could go to the waiting area and the doctor would be with us shortly. And I feel like this was one of the things that felt really bad. You know, the part of me that's hungry for knowledge is like, why would there be a sac and nothing else? And then there's the part of me that was planning a baby shower and a registry that was very confused and feeling a little emotional about this. And my husband does not have the medical literacy that I do, and he decided that moment was when he was going to look at our registry and talk to me about swaddle blankets. So in a very public waiting room with lots of other pregnant people and their partners and friends that had come with them for their checkups, because it's an OB's office, I got to listen to my husband tell me about the different swaddle blankets and why he liked them and why he didn't like them. And meanwhile, I'm Googling on my phone empty amniotic sac and reading all about blighted ovum and embryonic, without an embryo, pregnancy, which is what our pregnancy was. And I realized that because there was no other thing that would cause me to have an empty amniotic sac in my uterus. That was really not a good time. It was really hard, and I wouldn't wish anyone to have to go through that. And my provider, who I had never met before, this is my first time meeting this provider, did actually apologize that I had to go through that, and had said that usually they try to have the provider come into the ultrasound to talk to someone when that's happening. So I don't know who dropped the ball, if it was the ultrasound tech that didn't bring the provider right away, or if the provider just wasn't available. Having to go into a public space after I just had pretty devastating news was not fun. And then when we did get brought back into the exam room, because I knew what was going on, and my husband continually was telling me about the swaddle blankets, I did tell him, hey, there's no baby. That's what the ultrasound showed. That's what she meant when she said there's a sac but nothing else. There's no baby. And that was hard. And then after I told him that, the nurse practitioner did come in and tell me, and the way she described it, which I had been on the internet reading about it, so it wasn't like she needed to tell me what was going on. I knew. She said we call this a missed miscarriage. It just means that you had a miscarriage and you haven't had any bleeding or any other symptoms of the miscarriage, but there's no heartbeat activity on the ultrasound, so there's not a viable embryo. Again, the other terminology was a blighted ovum or an embryonic pregnancy. That's going to be the end of this video. We're going to move on to the next one.